Stop ignoring mucus in your throat, because that thick, sticky feeling you keep clearing every morning may not be what you think. Most people assume it is just phlegm, just age, just a little allergy, just something that happens after 50 or 60. So they cough, swallow, drink water, take lozenges, use honey, maybe buy another syrup from the pharmacy, and then they go on with their day. But the strange part is this: it keeps coming back. You clear your throat before breakfast, and by mid-morning it is there again. You try to speak, but your voice sounds rough or coated. You swallow several times, but the sensation does not disappear. You drink something warm, and for a few minutes, it feels better. Then, quietly, that mucus returns to the back of your throat like it never left. And here is what I want you to understand right away. Persistent mucus in the throat is not always coming from your lungs. In many people, especially after 50, the real cause is not a chest infection, not a cold, and not simply too much phlegm. The real cause may be irritation happening higher up in the throat, behind the nose, around the voice box, or even coming from the stomach while you sleep. That is why many people treat it the wrong way for months or even years. They keep trying to remove the mucus, but they never ask the more important question: why is the body producing it in the first place? I am Dr. Michael Carter, and today I want to walk you through what persistent throat mucus really means, why so many people are told to ignore it, and the hidden causes that are often missed when someone keeps clearing their throat every day. And before we go deeper, I want you to do something simple. In the comments, tell me how long you have been dealing with this mucus sensation in your throat. Has it been a few weeks? A few months? More than a year? And if anyone has ever told you that is just your age, write the word dismissed in your comment. Because I want to know how many people watching this have been living with a symptom that was never properly explained. Now let's begin with something very important. Mucus is not your enemy. That may surprise you because when mucus is stuck in your throat, it feels like the problem. It feels like something dirty, annoying, or unnecessary that your body should simply stop making. But in reality, mucus is one of your body's most important protection systems. Every day, your body produces mucus to trap dust, allergens, smoke particles, bacteria, viruses, and other irritants before they can move deeper into your airways. It also keeps the lining of your nose, throat, and breathing passages moist and protected. Without mucus, your throat and airways would become dry, irritated, inflamed, and far more vulnerable. So the problem is not mucus itself. The problem begins when mucus becomes too thick, too sticky, or too constant. Healthy mucus should move quietly. You usually do not notice it. It flows, drains, and clears naturally. But when something irritates your throat, your sinuses, your stomach, or your airway lining, the body may start producing more mucus as protection. And when that mucus becomes thick, it no longer clears smoothly. It sits in the back of the throat. It makes you swallow more. It makes you cough. It makes you clear your throat again and again. This is why simply taking a cough syrup often does not solve the real issue, because syrup may soothe the throat for a short time, but if the irritation is still happening, the mucus will return. And after 50, this becomes even more common for several reasons. As the body ages, the tiny hair-like structures inside the airway called cilia may become slower at moving mucus out. The swallowing muscles may not work with the same strength and coordination they once had. The throat may become more sensitive to dryness, reflux, smoke, cleaning products, pollution, and indoor air conditioning. And the body's thirst signal often becomes weaker, which means many older adults are mildly dehydrated without feeling thirsty. That combination can turn a small irritation into a daily problem. At 35 or 40, your body may clear mucus quickly and silently. But at 60, 70, or 80, the same trigger may create a heavy, sticky sensation that stays in the throat all day. Let me give you an example. A patient I will call Margaret, 67 years old, came to me after nearly a year of constant throat clearing. She was not severely sick. She did not have a fever. She did not feel chest pain. Her breathing was mostly normal. But she kept saying the same thing. "Doctor, my throat never feels clean." She had tried warm lemon water. She had tried honey. She had tried pharmacy lozenges. She had tried sleeping with an extra pillow. She even changed her toothpaste because she thought maybe something was irritating her throat. Nothing worked for long. Every morning she woke up with thick mucus sitting in the back of her throat. She would clear it before speaking to her husband. Then she would clear it again after breakfast. Then again before answering the phone. By the afternoon, her throat felt tired. By evening, her voice sounded slightly hoarse. And when she had mentioned it before, she was told, "That is normal as you get older." But it was not that simple. When we looked carefully at her routine, 3 things stood out. She was eating dinner very late, often less than 1 hour before bed. She was sleeping flat, and she was taking medication for joint pain several times per week without realizing it could be worsening irritation and reflux symptoms. Her throat mucus was not just mucus. It was a signal. Her throat was being irritated during the night, and her body was producing mucus to protect itself. Once she began adjusting her evening meals, raising the head of her bed properly, improving hydration, and speaking with her doctor about her medication routine, the pattern started to change. Within a few weeks, she told me something she had not said in months. "I woke up and my throat felt normal." That is why I do not want you to ignore this symptom. Because when mucus keeps coming back, your body may be trying to tell you something. Now, the first hidden cause we need to talk about is one of the most overlooked causes of persistent throat mucus in adults over 50. And this cause surprises many people because it does not always feel like a stomach problem. It is called silent reflux. Most people know what acid reflux feels like when it burns. You eat a heavy meal, drink coffee, lie down too soon, and then you feel that burning sensation in the chest. That is classic reflux. But silent reflux is different. With silent reflux, small amounts of stomach acid or digestive fluid travel upward while you are lying down. But instead of causing obvious heartburn, the irritation reaches the throat, the voice box, and the upper airway. The throat is much more delicate than the stomach. It is not designed to handle acid exposure, so even a small amount can trigger inflammation. And what does the throat do when it feels irritated? It produces mucus. Not because something is wrong with the mucus, but because the mucus is trying to coat and protect the irritated tissue. This is why silent reflux can be so confusing. You may not feel burning. You may not feel stomach pain. You may not even think digestion has anything to do with your throat, but you wake up with mucus. You clear your throat in the morning. Your voice sounds raspy. You feel like something is stuck back there. You may cough more when lying down or bending forward. And because there is no obvious heartburn, many people never connect it to reflux. They think it is allergies. They think it is a cold that never went away. They think it is normal aging. But in many cases, the throat is reacting to acid exposure that happened quietly overnight. This is especially important if your mucus is worse in the morning. Morning throat mucus is a major clue. It often means something is happening while you sleep. If you lie flat shortly after eating, gravity is no longer helping keep stomach contents where they belong. The stomach is still working. Digestion is still active. Pressure can build, and small amounts of acid can move upward toward the throat. Then you wake up and feel like your throat is coated. You clear it once, then again, then again. But clearing the throat only gives temporary relief. It does not stop the nighttime irritation that keeps triggering the mucus. So what can you do? The first step is simple. Stop eating too close to bedtime. Try to finish your last meal at least 3 hours before lying down. This gives your stomach time to empty and reduces the chance of reflux while you sleep. Many people underestimate this one habit, but eating late, especially heavier meals, fried foods, spicy foods, chocolate, alcohol, or large portions, can make silent reflux much worse. The second step is to elevate the head of your bed. And I do not mean stacking pillows under your head. That usually bends your neck and may even increase pressure around the stomach. The better option is to gently raise the head end of the bed or use a proper wedge that inclines the upper body. This allows gravity to help keep stomach contents lower during the night. The third step is to pay attention to your morning voice. If your voice is rough when you wake up, if you clear your throat before you can speak normally, or if you feel a lump-like sensation without real pain, silent reflux should be considered. But remember this: do not diagnose yourself based on one symptom. These signs are clues. The right approach is to observe the pattern and speak with your doctor, especially if the symptoms are persistent, worsening, or associated with pain, difficulty swallowing, weight loss, blood, shortness of breath, or a chronic cough that does not improve, because mucus may be common, but persistent mucus should not be ignored. Now let's talk about the second hidden cause of mucus in the throat, and this one is extremely common. It is called post-nasal drip. But before you assume, "No, doctor, that is not me. My nose is not blocked," I want you to listen carefully. Because post-nasal drip does not always feel like a dramatic sinus problem. It does not always come with facial pressure, severe congestion, or a runny nose. Sometimes, especially after 50, it is quiet. You may breathe almost normally through your nose. You may not feel sick. You may not have a fever. You may not even notice mucus coming out of your nose during the day. But while you sleep, mucus from your nasal passages and sinuses may slowly drain down the back of your throat. Then, when you wake up, the first thing you feel is that thick, sticky coating sitting right where you swallow. You clear your throat, you cough once or twice, you drink water, and for a few minutes you feel better. But then it returns. That is why so many people confuse post-nasal drip with a throat problem. They feel the symptom in the throat, but the source is often higher up, in the nose and sinuses. This is one of the most important things to understand about chronic mucus. The place where you feel the mucus is not always the place where the problem begins. Your nose and sinuses are constantly producing mucus. That is normal. Their job is to humidify the air you breathe, trap particles, protect the airway, and keep the respiratory system clean. But when the lining of the nose becomes inflamed, irritated, or dry, mucus production can increase. And when that mucus becomes thicker, it does not drain smoothly. It starts to collect. It drips slowly. It moves backward instead of forward. And because you are lying down at night, gravity helps that mucus slide into the back of the throat. This is why many people with post-nasal drip say the same things. My throat is worse in the morning. I feel like I have to clear my throat before I speak. I do not feel sick, but something is always there. I keep swallowing mucus, but it never fully goes away. I cough more when I lie down. If that sounds familiar, your throat may not be the main problem. Your nose may be silently feeding the mucus sensation all day. Now, what causes this kind of post-nasal drip? There are several possibilities. Allergies are one. Dust, pollen, mold, pet dander, strong perfumes, and indoor irritants can inflame the nasal passages and trigger excess mucus. But allergies are not the only cause. Dry air is another major factor, especially for older adults. Air conditioning, heaters, closed bedrooms, and low humidity can dry out the nasal lining. When the nose becomes dry, the body may respond by producing thicker mucus to protect the tissue. Sinus inflammation can also be present even without severe pain. Many people imagine sinus problems as intense pressure in the forehead or cheeks, but chronic low-level sinus inflammation can be much more subtle. It can simply create ongoing drainage that ends up in the throat. And here is another detail most people overlook. Some medications can dry the nose and throat. When the mucus becomes too dry, it becomes harder to move. So instead of clearing naturally, it gets sticky and uncomfortable. The person then clears the throat more aggressively, which irritates the throat even more, creating a cycle. Mucus irritates the throat. Throat clearing irritates the throat. Irritated throat produces more mucus, and the cycle continues. This is why forceful throat clearing can make the problem worse over time. It gives a few seconds of relief, but it also creates friction and irritation around the vocal cords. The more irritated that area becomes, the more sensitive it becomes. Then even a small amount of mucus feels unbearable. A better approach is to sip water, swallow gently, or use a soft cough instead of repeatedly scraping the throat. Now, one of the simplest and most effective tools for post-nasal drip is nasal rinsing. And I know it sounds almost too simple. Many people want something stronger, something more complicated, something that feels more medical. But a gentle saline nasal rinse can be powerful because it addresses the source directly. It helps wash away dust, allergens, irritants, and thick mucus from the nasal passages. It helps moisturize the lining. It helps reduce the material that would otherwise drain down into the throat overnight. But there is one important rule. Never use plain tap water directly in your nose. Use sterile water, distilled water, or water that has been boiled and then cooled to a safe, comfortable temperature. Water that is safe to drink is not always safe to introduce directly into the nasal passages. So be careful with this step. You can use a saline packet designed for nasal rinsing or follow your doctor's instructions. The goal is not to burn, force, or flood the nose aggressively. The goal is gentle cleaning and hydration. For many people, doing this once in the evening can reduce the amount of mucus that drains into the throat overnight. For others, morning and evening works better. But consistency matters. Trying it once and stopping is not enough to judge whether it helps. Give it several days. Observe the pattern. Ask yourself, is the morning mucus less thick? Am I clearing my throat less? Is my voice less rough? Do I feel less drainage when I lie down? And right now, I want you to comment below. Have you ever tried nasal rinsing for throat mucus? Did it help? Did it do nothing? Or have you never tried it before? Your comment may help someone else who has been afraid to try it. Now let's talk about something very important. When should you not ignore mucus? Because although mucus is often linked to reflux, post-nasal drip, allergies, dryness, or irritation, there are warning signs that deserve medical attention. If mucus is associated with coughing up blood, unexplained weight loss, fever that does not go away, chest pain, worsening shortness of breath, difficulty swallowing, severe pain, or symptoms that keep getting worse instead of improving, do not treat it as a simple home problem. Speak to a doctor. And if you have a history of smoking, chronic lung disease, cancer, severe reflux, or immune problems, persistent throat symptoms should be evaluated properly. This video is educational, but it does not replace medical care. Now, after silent reflux and postnasal drip, there is a third cause that many people never suspect. And this one is delicate because it involves something people may be taking every single day to help another health condition. Medications. Certain medications can contribute to throat mucus in different ways. Some dry out the mouth, nose, and throat. Some can worsen reflux. Some can cause a persistent cough or throat irritation. Some may make mucus feel thicker because they reduce moisture in the airway. And this is especially relevant after 50 or 60 because many people are taking more than one medication. One for blood pressure, one for pain, one for sleep, one for allergies, one for bladder symptoms, one for mood, one for digestion. And sometimes the combination creates dryness, irritation, or reflux that no one connects to the throat. Let me be very clear. Never stop a medication on your own. Never change your dose because of a video. But if your mucus started around the time you began a new medication, or if it became worse after your dose changed, that is worth discussing with your doctor or pharmacist. You can say something simple. Could any of my medications be contributing to throat clearing, dry throat, reflux, cough, or thicker mucus? That one question can open an important conversation. Some blood pressure medications, for example, are known to cause cough or throat irritation in certain people. Some pain medications can irritate the stomach or contribute to reflux. Some allergy medications may dry mucus so much that it becomes thicker and harder to clear. Some sleep aids or bladder medications may dry the mouth and throat overnight. Again, the medication may be necessary. It may be helping you. But if it is contributing to the symptom, your doctor may be able to adjust timing, dose, or choose an alternative. The problem is that many people never ask. They keep treating the mucus with lozenges and syrups, while the trigger is sitting quietly in their medicine cabinet. This is why a full medication review can be so useful. Write down everything you take: prescriptions, over-the-counter pills, supplements, pain relievers, allergy tablets, sleep aids, and even occasional medications. Bring that list to your doctor. Mention when the mucus started. Mention whether it is worse in the morning, after meals, when lying down, or after taking certain pills. Patterns matter. Your body leaves clues, and mucus in the throat is often one of those clues. Now let's bring everything together. If mucus in your throat keeps coming back every day, the answer is usually not to attack the mucus itself. The real answer is to reduce the irritation that keeps making your body produce it. And one of the most ignored sources of irritation is the air around you. Your throat reacts to everything you breathe in. Strong cleaning products, perfumes, cigarette smoke, wood smoke, dust, mold, traffic pollution, dry air from air conditioning, heated indoor air, scented candles, and even a fan blowing directly toward your face at night can irritate the delicate lining of your throat. And when the throat feels irritated, it protects itself by producing mucus. That is why some people feel worse in the morning, worse in the bedroom, or worse during colder months when the windows stay closed and the air becomes dry. So if your mucus is strongest when you wake up, look carefully at your bedroom. Is there dust near the bed? Do you sleep with a fan or air conditioner blowing toward your face? Are there strong fragrances in the room? Could there be mold near the windows or air conditioning? Do pets sleep close to your pillow? These small details can make a big difference, especially after 50, when the throat and airways may become more sensitive. Now let's talk about hydration. When your body is well hydrated, mucus stays thinner and easier to clear. But when you are even mildly dehydrated, mucus becomes thicker, stickier, and harder to move. It clings to the back of the throat and creates that constant need to swallow, cough, or clear your throat. And here's the problem. After 50 or 60, many people do not feel thirst as strongly as they used to. So you may be dehydrated without realizing it. A simple habit can help. Start your morning with 1 or 2 glasses of plain warm water before anything else. Before coffee, before breakfast, before medications, unless your doctor has told you otherwise. Warm water can help loosen mucus that collected overnight and rehydrate the throat before you begin talking, coughing, or clearing. This does not cure every cause, but for many people, it makes the morning mucus much easier to manage. Now, let's talk about common home remedies. Honey can soothe the throat, but it does not fix silent reflux, post-nasal drip, medication side effects, or dry air. So if honey helps for a few minutes and the mucus comes back, that means it is only calming the symptom, not solving the cause. Lemon water can help some people, but it can irritate others, especially if reflux is involved, because lemon is acidic. Dairy does not create mucus out of nothing, but some people feel that milk, yogurt, or cheese makes existing mucus feel thicker. If you notice that pattern, reduce dairy for a short period and see whether your throat feels clearer. The key is not fear. The key is observation. Your body gives clues. Now here is a simple plan you can begin today. First, stop eating at least 3 hours before bed. This helps reduce the chance of silent reflux irritating your throat while you sleep. Second, raise your upper body at night with a wedge pillow or by slightly elevating the head of the bed. Do not just stack pillows under your neck, because that can bend the throat and make things worse. Third, start the morning with warm water before coffee. Fourth, consider a gentle saline nasal rinse if you feel post-nasal drip, allergies, congestion, or morning mucus. But only use distilled, sterile, or previously boiled and cooled water. Do not use plain tap water directly in your nose. Fifth, review your medications with your doctor or pharmacist. Ask one simple question. Could any of my medications be causing dry throat, reflux, cough, or thicker mucus? Never stop a medication on your own, but asking this question can reveal a connection many people miss. Sixth, reduce irritants in your bedroom. Clean dust, wash pillowcases, avoid strong fragrances, check for mold, and do not sleep with air blowing directly into your face. And seventh, stop forcefully clearing your throat all day. I know it feels relieving for a few seconds, but repeated harsh throat clearing can irritate the vocal cords and make the throat even more sensitive. Instead, sip water, swallow gently, or use a soft cough when needed. Now, most cases of throat mucus are not emergencies, but some signs should never be ignored. If you have blood in your mucus, difficulty swallowing, unexplained weight loss, severe pain, fever that does not go away, shortness of breath, chest pain, a lump in the neck, or symptoms that keep getting worse, speak with a doctor, especially if you have a history of smoking or another serious health condition. So remember the main message of this video. Mucus is not the enemy. Mucus is a signal. It may be telling you that acid is reaching your throat at night. It may be telling you that mucus is draining from your nose and sinuses. It may be telling you that Your medication, hydration, bedroom air, or daily habits need attention. The mistake is spending months trying to clear the mucus without asking why it keeps coming back. Your throat may be trying to protect you, and when you understand the cause, you can finally stop treating this like a random inconvenience and start responding to it the right way. If this video helped you understand your throat mucus in a new way, please subscribe to the channel, like this video, and share it with someone who keeps clearing their throat and has been told it is just age. And before you go, leave a comment below with the word throat if you want more videos like this about common symptoms people over 50 should stop ignoring. This video is for educational and informational purposes only and does not replace medical advice. Always speak with your doctor or a qualified healthcare professional before changing medications, starting treatments, or ignoring persistent symptoms. I am Dr. Michael Carter, and I will see you in the next video.